Today, discuss about the nursing process with a simple method step by step in the nursing process meaning of ADPIE. Definition of nursing process. Nursing process is a systematic method of planning and providing individualized nursing care. It includes assessment, diagnosis, planning, implementation, and evaluation. Assessment. The initial phase involves the systematic collection of both subjective and objective data about the client health status. Data can be gathered through patient interviews, physical examinations, and reviewing medical and family history. Diagnosis. Using clinical judgment to identify a patient's actual or potential health problems or needs, which describes the client's response to a health condition. Planning. Based on the nursing diagnosis, the nurse develops a care plan that includes setting specific, measurable goals, identifying potential outcomes, and outline nursing intervention to achieve those goals. Implementation. The phase involves performing the intervention and carrying out the actions detailed in the care plan. It is the direct provision of nursing care to meet the client's needs. Evaluation. The final step is to assess the client's progress towards the established goals and determine the effectiveness of the nursing intervention. If goals are not met, the care plan is adjusted and the cycle may begin again.